Good evening, everyone.
Hello, everyone.
Yes, thank you for joining us for our webinar. We would be talking today about PDO thread lifting procedures. It's our monthly webinars, ITS Aesthetic Pulse. I'm Dr. Natalya Fazilova, and we have a guest speaker today with us. That's Mr. Sergey Sienkiewicz. And we usually do monthly webinars on new trends in aesthetic medicine. If anything new and exciting comes up, we usually try to cover this topic. And there's a lot of new information you would be learning today. So stay with us till the end, and you will see a lot of interesting stuff, some videos, how procedures are done. So we will be covering new trends, PDO thread lifting procedures. Why are they so popular? Is there anything revenue-wise that you would be seeing and you would be able to learn patient satisfaction, any retention rate for the patients, and what kind of latest, newest procedures that's available for using this procedure. Any business integration strategies or suggestion would be sharing with you as well, and what kind of hands-on opportunities you might have if you decide to implement these procedures in your practice. Some housekeeping things. We have a chat available for you to submit questions. We will have a question and answer session at the end. So definitely send your questions. We'll try to cover as much as we can during the webinar, but if there's something that comes up, we could definitely let us know if you want us to answer some additional questions. Okay. Let's continue. Okay, this is our information. This is our Instagram and website. If anybody is interested, you could scan and see more information about us for now. But before we get started, I would like to know who is our audience. So take a minute, and if you could write in the chat or in the Q&A section, if you could hear us well, if you could see us, where you're from. Are you from New York? We're located in New York. Are you in New York? If you would like to share some information, what you do, what's your profession, if you registered for the webinar, what was the cause of it? What are you interested to learn on this webinar? So we definitely could go over those questions a little bit later, but that would be something that we could start with. Saying they cannot see us. Why? Because we're able to see. Can you write in the chart for other guests if you're able to see us? So one of the attendees is saying that they're not able to see us. And I see some. Okay, so why people are writing where they're from? Let me introduce our guest speaker. We have Mr. Sergey Sienkiewicz with us today. And I've known Sergey for a while, and he's internationally recognized representative and manufacturer with Victoria PDO Thread Company, which he will be explaining a little bit later more about the company, about the actual field of PDO. He's been in market for a long time, worldwide, dealing with a lot of different new techniques, new technologies that come up usually, and their company pioneered double needle thread lifting method and a lot of European training and European counts that he could share with us, new things that come up in other countries as well. So he's a medical consultant on the team of 25 years experience in this field, so has a lot of information to share. And Sergey, if you want to add something else about yourself, that would be great. Now is a good time.
Yep, thank you very much for inviting me. Yes, we've known each other for some time, and we had some experience working together doing the PDO lifting threads with quite some success. We started manufacturing PDO threads in 2014, and since that time we went through European Union. We also started a business in the United States and successfully with ITS Academy promoting education of this very interesting and unique tool that we use in aesthetic medicine. There's going to be some examples of how it can be used and some befores and afters, and also we're going to give some insights on why PDO threads is uniquely positioned and why this is so different from everything else that is available in the market, and what type of goals we can achieve by using this instrument. And there's going to be also some information at the end of the webinar about our upcoming events and some benefits that we are planning to offer to the students of our classes. Natalia, back to you.
Thank you, Sergey. And a little bit about myself. Doctor of Nursing Practice. I've been teaching as a City University of New York associate professor more than 15 years. I also have a medical clinic in New York City in Midtown 59 and Madison, and also provide continuing education credits. I'm a founder and director of ITS Academy, where we teach all the aesthetic courses, provide continuing educations. I've been in aesthetic field since 2014, officially, maybe a little bit more so. I'm also a licensed esthetician, so have a lot of experience in aesthetic, love the field. I'm also certified as a functional medicine and integrative medicine specialist, and kind of have a breach or the gap to bridge between functional medicine, wellness, and health and aesthetic. And I feel like they go hand in hand together. And when COVID happened, when everybody was afraid and staying home and wasn't sure what will happen, I spent the time preparing all our continuing education courses, and we launched our academy in 21. So I kind of spent COVID productively, put it this way, and kind of enjoyed teaching and enjoy sharing my knowledge with other people. And the field of aesthetics booming. There's more and more people getting trained, and the skill set is getting better and better. The training centers are getting better, and I'm glad that students are more active and excited to take these courses, because when I started 10 years ago, we didn't have that many courses available at the time, and I had to do additional training after I've taken some courses here. I did some additional training by traveling to Europe and other countries, because there was more advanced training available back those time. And I'm glad that the United States are getting better in that respect, and we're getting better and better trainings available. But that's my journey. So we'll share a little more information on the procedure itself and the results that we're getting for this procedure, the revenue that we're making. Kind of will be speaking directly from our experience. So let's see who our audience is. So thank you for seeing that you're saying the chat is disabled. I'm not sure why, but I see your information in Q&A section. So I'm seeing that we're having people from New York. I see people are here from Texas, from San Antonio, from Ohio. Oh, so you know, not only New Yorkers, I see people from other states as well. Well, thank you for joining from St. Paul, from Chicago. Sergey, it looks like we got a lot of other states as well, which is great. Thank you guys for joining. And I see that the RNs are here, medical doctors are here, and the different medical professionals. So yes, aesthetic field, and I've been training in the past 4 years, I don't know, approximately 500 students already that took our courses. And I do see a mix of RNs and Ps, PAs, MDs, and even dentists getting into aesthetic field. So definitely for all of you, it's going to be useful information, because tread lifting as a procedure becoming more and more popular, and we're seeing more and more and better results. And we'll show you some videos with the skills and results as well. So hopefully you will get enough knowledge at least to know what it is, and if you should try to go into this field or try offering these procedures to your patients. History of tread lifting. Sergey, I would like you to share your expertise. You've been doing it for a while, much longer than I am, and tell us a little bit why it's becoming so popular, where it all started. Like, tell us what you have seen as an evolution of what you see the progression, I guess, of this procedure and why it's becoming more and more popular as compared to what it was, let's say, 10 years ago?
Well, it's becoming much popular these days, and the reason is that thread lifting gives us great results. If you do it all the time, every year or every couple of years, so it's definitely creates some significant results and aesthetic effect on patients' faces. But it started, you'll be surprised, it started back in ancient Egypt. In Egypt, they were implanting golden threads in the faces to keep the ptosis, to keep away the ptosis. This same technology that was reintroduced back, I think, in the 40s and the 50s in Switzerland when they started to use the golden threads. But real expansion of the method we started to see at the end of the 90s. Where it was a Georgian, the state of Georgia, not American, but in the Caucasus. Marlene Solomonidze, many providers know his name. He was then working for the Plastic Surgery Institute in Moscow, and they weren't able to service all the requests that they were getting from the population of the country. They were able to service only 25% of all requests that were coming in for the plastic surgery, because plastic surgery back then was the only method enabled us to work with the saggy skin, with excess skin on the face, and to do the effective facelift. So they were able to service only 25% of the demand that was coming in. And as an idea, they started to experiment with the threads, then non-resorbable, but the experiment was very successful, and they were getting very tangible and good aesthetic results. And that's how they started the method. The Koreans started to develop their own techniques with the polydioxanone threads around the same time, and this is when we see the development of this field and the method and development of the aesthetic medicine back then. And it really started to boom probably in the very beginning of the 2000s, when the more injectables were coming in, and then more European products were getting developed with the big names like Merz and Galderma, as we know them. This is when we started to see a lot of thread techniques coming to the market. They also came to the United States then, the thread as a method, but since the school of the method was not really developed back then, there were many mistakes, there were many complications, and FDA then put a hold on many of the brands that were coming into the market. And for a while, this method moved away from the American market and started to develop in Asia, in Russia, in Ukraine, and the European Union, where the actual practice and the actual techniques and the actual method and the know-how to do the correct thread lifting with the threads started to develop. And we're looking at 30 years of experience now, practically. And within this 30 years of experience, we have seen development of probably about 50 different models now available for the thread lifting, for different different areas of the face, for different areas of the body. And effectively, you can do anything with the threads today, including volumizing. And looks like it's kind of a complicated instrument, but in reality, when you master this, you can do so many beautiful things with the faces of patients. And this method gives a very natural look, very natural result. And this method is positioned very uniquely because There is no instrument in the aesthetic medicine field that can do the same thing as the thread. And we're going to talk about this a bit later.
Yeah, don't spoil
But
the
yeah, I'm not going
surprise.
to do spoil.
We
Yes.
will show them a little bit later, actually, the results that the threads will give. So explain to us, what is the PDO thread therapy? I know there's a lot of talk about it. I work with a lot of plastic surgeons. There's some pushback from plastic surgeons. And going back to what you mentioned at the beginning, when the whole therapy was introduced, it was not done properly. And there was a lot of complications and backlash. And some of my plastic surgeons, they hate this procedure. We talked about it and they don't want to
And they
do it, but
should.
right, if anything that's not done correctly, obviously would be having complications and having issues. And they usually complain that they have issues usually when they do plastic surgery, when someone places the thread improperly and it causes fibrosis if it's not placed in the right layer. Eventually, for the facelift procedure, it becomes problematic. But tell us first what PDO thread therapy is, what is it made of, and what's the whole process of how it works and what happens to it. And then later I will talk about how it's done and what the results I were looking for. So go ahead.
Yeah. The polydioxanone, the PDO stands for polydioxanone. It's a polymer which is bioneutral, which means that it doesn't come into any reaction with the human tissue. Polydioxanone has been in the general medicine practice in general surgery for probably 40 years, and this, the suture itself is available and known to medical doctors and medical providers very well. But as an instrument that enables you to do a facial lift, it just became available to us very recently. And what we can do, we can stitch together as we age, our fat compartments, they disintegrate and the tissues become thin. So what PDO thread effectively does, it enables us to stitch together the fat compartments and bring our face back to the original, sort of speak, form as we were young. And the thread is placed in the subcutaneous fat, then it's getting replaced by the developing connective tissue, and over the course of 1 year we have the PDO thread resorbed and disappearing and getting replaced with the fibrous tissue, which is holding the aesthetic effect of the thread lifting. Uh, uh, along the way, we also have some collagen synthesis that is taking place with the thread lifting. But effectively, there are several materials right now available in the market. Polydioxanone is the only one that's cleared by FDA. There's also polylactic acid that is available in the form of a thread. Many of the providers are familiar with the product like Sculptra. This is a hard form of polylactic acid, and there's also a caprolactam also as a product. It's a bioneutral material, just like as PDO, but this material is much more long-lasting, and the results of doing the thread lifting with the polycaprolactam can last up to 3 to 4 years. So these three materials are present throughout the world in different markets. Regulators are looking at them differently. The FDA has now approved only the PDO for this particular procedure. European regulator has the PLLA available and polycaprolactam available. There's also another polymer. It's a polycaprolactam with polylactic acid, but all materials are very safe. They are getting resorbed with time, and the absorption method is hydrolysis, so it is effective with water and CO2 that is getting released by the body. So we have three different materials for three different purposes, and all of them are playing a great and interesting role in the world of thread lifting.
Okay. And now, where this threads or which form these threads are available is also a very interesting component of the procedure, because it's not just one PDO thread that you apply everywhere, right? We have different type, and why do we need so many different types? Like, why can't we just take one and work everywhere? So tell us a little bit of a difference. And I know your company has actually something that other companies don't have, which I have on the following slide, the double needle, but give us a little bit of a brief overview. What do we need such a, and it's not everything. I think you have more. This doesn't cover all, but the most common ones. So why so many? What's the difference? And why do we need so many?
First and foremost, aesthetic needs of every patient are different. That's the most important part. Then we have different thickness of skin on different parts of face, and this is when we have different USPs used for different models. Also, the physiological reasons are different as well. Sometimes we do reinforcement of the loose subcutaneous fat on the younger faces, or on the faces of patients that are older. We also need to perform reinforcement procedures to prepare them for the actual thread lifting. So that's when it comes to the USPs. That's when it comes to difference between the smooth threads or the lifting threads. The smooth threads can also be in the form of a linear monothread, or it can be in the form of a screw spiral. Why do we need spiral? Why do we have screws? Because these screw types, they create additional surface for the collagen development, for the connective tissue development. So we effectively have a greater lifting results. And the lifting threads. With the lifting threads, what we effectively do, we reposition the tissue that is maybe sagging, or maybe loose, or maybe not as firm as we would like it to be. So with the lifting thread, we reposition the tissue upwards, and effectively we eliminate the excess of skin that is on the patient's face that is experienced ptosis.
So each particular thread type has its own indication, right? So
yes,
we have for collagen building, we have for lifting, we have for support. So, and we will show some techniques
reinforcement
a little
for
bit.
different
Yes.
areas of the
So
face.
yes, so it's not like one type and not a cookie cutter approach. As you mentioned, each patient has its own anatomy, skin texture, and we've seen a lot of different type of results and skin texture when we do classes training, when we get models to the class. Even the same day, students usually see 4, 5, 6 different models, and each one of them comes in different age group, different
Yes.
skin texture, a different ethnicity, and each one of them needs individualized. And they might need a few different type of threads for one procedure, right? So it's kind of interesting that there is such a big variety, and each thread has its own indication, which is pretty amazing, and usually during the class interesting to see. Now tell us, this is something exciting. I've seen these threads before, was waiting for a while for them to be available in United States. So tell us, what's the difference? They look like crochet needle to me. That's what my grandma used to use when she was making sweaters when I was a little girl, but it's not a crochet needle, I know that. But what's the difference? What's the difference between this type of threads and the threads that we have for all other companies? We're talking about PDO Max, Mint. I know none of them has it. So what's such a big buzz, and why? Like, why? What's the difference?
Well, it's just one of the latest. It's one of the latest instruments that became available to the providers of thread lifting, and with this instrument we can effectively do thread lifting for any patient, because with what it has a multiple points uh, of adhesion to the tissues, so we can very effectively reposition the tissue, no matter how heavy the tissues are, and no matter how saggy the face of a patient is. And this is in effect endoscopic. You can look at it this way: endoscopic procedure that can lift, that can reposition tissue very well. And the result after using this instrument in thread lifting can last after 3 years.
So it gives better and bigger support, and I see that it has all the cogs and barbs on it, I should say, to give a better support. And I've seen this being used actually for body parts, right? It's strong enough
Yeah.
to hold heavy tissue, because we had issues before. And I remember my first experience when I had threads placed. Now I understand that it wasn't done correctly, but I barely got the result, because my understanding was maybe the practitioner who placed it wasn't experienced enough, or maybe wrong technique, or maybe it was that I do happen to have a heavier skin tissue type, and I need something stronger than what was used on me. And I hear it a lot from my patients. If when I offer them, it's like, oh, no, 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 I've done it. It doesn't work for me. I'm not going to do it. It's just waste of money. It's waste of time. And now looking at all the experience and all the results that we have lately, I see the difference. So it is the technique. And yes, these threads are much how they could help to lift a heavier weight, let's put it this way, right? So because I do see great results, and kind of it's good to know that we have it available. I was excited to find out when they became available here. So, and we will show a technique a little bit later. Why it's considered one of a kind procedure?
Well, because
Tell us.
none of the instruments that we have available to us, such as skin boosters or the fillers or the Botox or any other solutions, none of them can actually do the job in stitching together a face of a patient. And this is the biggest issue that we face in aesthetic medicine, because under our fat compartments become thinner, they are disintegrating, they are losing, they are losing a border between them, and they are moving down south under the influence of gravitational force. So, and this is the reason why we have jowls, why we have disformed faces caused by the gravitational ptosis. So, in order uh, to regain the contour of the face, the triangle of youth, we need to stitch back together the fat compartments, and this is what effectively threads do. It's very well illustrated with this diagram with little fairy balls, and how we can bring them together. And it's for the medical professionals a bit more detailed diagram with the tissue and the thread going in, stitching the tissues together. So this is what we effectively do. We pull the tissue together of the patient, and that's why and how we are regaining the triangle of youth. And then once you've gathered once you have it together, once you've stitched it together, then you can look what patient needs to do and what other procedures needs to be done for that patient.
So if we could make an analogy, first we're building the carcass, the structure of the face, we're giving support, because biggest issue is as
We're
we
regaining some, we're regaining
regaining
that
support,
structure.
yes, and then you do everything else on top of it, because without
Yes.
structure the house will just not stand, right? And as we
Yes.
get older with osteoporosis and bone resorption
Yes.
and everything else, there's a loss of fat deposit and fat pockets. Common question that I get asked by students, by patients, is how long do the treads last and what happens to the treads? The common misunderstanding, I think, is that once we place the treads, they pull the skin up, they're holding the skin, and then they disappear. That's not how it works. So the threads are placed, yes, they give original lift, but then when the thread gets dissolved, it forms the tissue and it pulls the tissue together to hold it in place. It's not like you lift it up with sticky and then that fall off. That's not how it works. And that's what seems to be a common misunderstanding from this procedure. So correct me if I'm wrong. It's not that it's the thread itself is lifting the tissue. It's forming the fibrous tissue and building collagen that lifts the tissue. Am I right?
And yes and no. Imagine the fat compartments that are disintegrating. And very often when I explain the effect of actual threads and how they work, I often use an analogy of, and many of us have done this in their backyard when making a kebab. So when we prepare a kebab for the roasting, what we do, we take the skewer and we put the meat on that skewer, and then we press it, and then we put it on the grill. And once the kebab is ready, we see that the pieces of meat I actually have glued together. And in a very similar way, the thread lifting method works. We bring together the disintegrating tissues, and then we force our organism to create connective tissue so they are staying together once they are healed, and the collagen builds on top of this, creating a more integrated the more integrated tissue that can stay together once the actual thread getting resorbed and replaced with the fibrous tissue, which holds it together in the next couple of years. After a couple of years, fibrous tissue, if it is a normal fibrous tissue, will disappear, and but you will still have the result.
Right. So the common goal of these procedures are not to return you back to 30 years younger, right? But to maintain, I think you mentioned it in one of the classes, and I laughed when you said it. What did you say? What's
Well, I
that?
said that you fix your age. You fix your age when you start doing aesthetic procedures. This is when you freeze.
You freeze your age when you
You
start. So
freeze,
if
yeah,
I
yeah, you
started it at
freeze,
30
yeah,
years of age, I would look like 30 for the next 70 years. Is that what it is?
yeah. That's
Or that's the
basically
goal, at least, right?
that's a goal, yeah.
That's the goal. No, if people having realistic
That's very
expectation,
true. It's not. It's
yeah, that
many,
seems to be.
many, many providers in aesthetic medicine would agree with me that they see their patients freeze their age when they start going to take up aesthetic procedures.
Yeah, so when they start. So the earlier they start, the younger they will look
Better it
moving
is, yeah,
forward. Okay.
yeah.
Okay. Objectives of thread lifting, right? Provide stable and supporting collagen. Already mentioned that. And correcting lines and wrinkles, near collagenous stimulation, skin surface reinforcement, natural and quality of aging, everything that you mentioned before. Unless you want to add something to the slide, then please do so.
No, I love this slide actually, because it shows how we can lift very heavy tissues with the support of the tensor threads, and this gentleman here illustrates how we could do that very effectively. And I actually believe that, not believe, I actually know that threads can provide natural and quality aging patterns to patients. I'm a patient myself, so I have experienced this procedure many times in my life, and I know I can imagine how my face would look like if I would not be doing the threads every year.
Okay, mechanism of action. I will speak on it a little bit from the medical perspective. Once we insert the thread, which we will show you a little bit later, there's a certain degree of inflammation happens on the insertion and the placement of the thread site, which will produce a little bit of a fibroblast around the thread while the thread is being absorbed and dissolved. Body, through healing properties, produces a fibroblast, which Sergey was mentioning, that will help us to build collagen, elastin fiber, increases blood supply and metabolism in that area by providing and stimulating new tissue to grow, new cell to grow. And the effect that we're looking for, depending on what type of threads we're looking, that skin rejuvenation, if we're doing more mono threads for superficial procedures, a lifting effect, tightening, and some brightening for superficial procedures too. And combination of treatments is something that's getting more and more popular and giving us better and better results. So you're building a house, you build the base first, and then you build upon it more and more. And with combining these procedures, you always start with the base and then you add on top. So definitely something that we're going to discuss a little bit later. But results, immediate results, you could see somewhat. We usually do hypercorrection, which you will see a little bit later in the video, during the actual procedure, but full results you see in about 2 months. And the little bit of a downside of this procedure, we kind of live in a population that want instant results. And even though you see some original results right after the procedure, it's not the final results. And a lot of people have no patience for it. But that's when your consultation and your education to the patient makes a big difference, because there's some downtime after the procedure as well. What are the indication? Forehead lines, frown lines for the skin texture. Obviously, it's not a neuromodulator that's going to stop the movement, or they're going to stop a muscle from moving, but definitely giving more support to the skin and building collagen and making skin of the forehead a little bit thicker, because we do lose volume and as we age in that area too, even though people don't pay attention to it, but there's definitely some volume loss in the forehead as well. Nose, bridge of the nose correction, cheek augmentation, nasolabial folds and line by pulling it up, a lip augmentation, marionette lines, a lot. And the latest one, the body augmentation as well, for décolleté, for hands, for butt augmentation, buttocks. We will show a video on it a little bit later too, for lifting and tightening the abdominal area. Smooth threads could be placed in around the knees, the elbows, anytime when there is a superficial wrinkle. So a lot of indications on where it could be applied. Again, considering that it's the right patient, considering that it's the right condition of the skin, and there's a lot of variables that needs to be taken into consideration. It doesn't mean that it will work for everybody. If it's not the right candidate, obviously you won't see the results that might be achieved for someone that would be better candidate for this procedure. But it does give a lot of good results, obviously, if it's done correctly and for the right candidate. Let's take a look now. Yes, it's exciting. It's a good procedure, gives good results, but does it make sense? For those of you who are in practice, you own your own practices, does it make sense to introduce something new to the practice? Because the bottom line for all of us, we have to pay rent, we have to pay our employees. So let's see what's the revenue option opportunity for this procedure. What is your cost of investment, and how much ROI you're looking forward to get from each procedure and single patient? And Sergey, you would be helping me with this. So we put a little bit of a cost and revenue analysis for simple procedures, and tell us a little bit on the cost of the product, considering that we're using the threads, maybe a little bit of anesthesia, like some supplies, how expensive it is to perform this procedure. Do we need any special equipment to perform this procedure? Like how much a practitioner who owns the practice need to invest to start and offer, and does it make sense?
Yes. Well, this example is actually depicted based on the actual patient that we have here that we've have done thread lifting
She
on.
was,
And
was one of our models, right? She
yes,
looks
one of our models. Yes, and you can see this beautiful
beautiful
results
results. Yeah.
that this lady has. I mean, this thread lifting procedure completely transformed her face. And after 1 month and a half, she sent me a message saying that this is amazing what you have done. I'm so grateful to you. I have completely changed, and I'm definitely coming back for another procedure when it will be due. So we have middle 1/3 of facelifting. We had done around the eyes reinforcement for her, and we also had the neck and under chin area reinforcement for her as well. And there you can see the costs for the middle third. It comes we need to use 10 lifting threads, which are $250 per blister. There's 10 of them inside. For the eyes, it's about 40, two blisters, so 20 threads, which is about $40. And for the neck and under the chin area, we have spent around 4 blisters or 40 threads for that area, and that's about $80. Altogether, when you are experienced, when you master the trade, you can spend on a procedure like this 1 hour, maybe 1 hour and a half. And the estimation for the revenue is about 2,200 $2,500, which is pretty good profitability rate for considering the cost and the cost of other consumables like the iodine or the needles.
Syringes, gloves, yeah, all
Yes.
the basic supplies that we have in the medical office. Yes. What I like about this procedure is it's very cost effective, gives
Yes.
great results. The cost of the product, they're not expensive. It's not like you're doing a filler or using other product that has a very high price tag to it. And the revenue is pretty good considering if it's a 1 hour procedure. We charge a little bit more per site that listed here. In our clinic, again, it depends on which area and which state you're in, but roughly on average, prices go one part of the face, $1,000 approximately. So whatever prices we have is here's an average, but it could be forehead is $1,000, mid face is $1,000, and the neck is another $1,000. So which is like 3,000 per procedure, if not more. So which the cost of the procedure, or I should say, which with the supplies and everything else, let's say like $500, right? So good revenue making procedure, pretty quick. Once you get more experience, it more or less gives a good ROI. And plus gives good results to the patient. Look at this lady; she is looking amazing. Nasolabial folds are gone, under eye bags are gone. Very nice shape. No jowls, so pretty good results. And results will last approximately 18 months, if not more, depending on the patient and how well they take care of their skin. So
Yeah.
profitability wise, it's a pretty profitable procedure. What is this procedure for? Um, for um, for this particular, if we're discussing tread lifting as a procedure itself, the main point or one of the biggest things that we could achieve with this procedure, which there's no other method available, it's lifting the saggy skin, saggy tissue. If for collagen building, we could use Sculpture, maybe Radice and other products, we don't have anything as of now that's going to help to lift and reposition the tissue that's hanging down from gravity and from aging process and loss of fat deposit. Plus, while we're lifting mechanically those tissues, we help to build collagen and fibroblast in the tissue that will keep the tissue in the place or in the shape and form where we lifted it through. So last a fairly good amount of time. And a younger patient, more collagen building properties of the skin. Older patient, we still see great results, but as we age, our capability of building collagen decreases, so result might not be as great as somebody who's 30, 40 years young, but we're still seeing good results even with advanced age for the patient. So it should not be an indicator of to do procedure or not. And we definitely discuss it when we do training in more detail, but just to give you an idea, when you look at the skin and look at the tissue, and when you place different type of threads in different layers of the skin, what you're trying to build is trying to build the support, and now the healing properties of the body will continue and maintain the support that was built at that time. We do use combination procedures when we do, let's say, thread lifting and combine it with PRP or plasma. We do combine treatment with other dermal fillers on top or neuromodulators. So it's not just one type of procedure that you do and that would be fixing all the problems that patient might have. It's usually a combined approach that gives the best result when you work on the skin texture, when you build collagen, but we always start with building the base first, and then we continue with the remaining treatments. Because the treatments are done in different layers of the skin, I'm talking about right now, let's say we're talking about dermal fillers, we're talking about PRP, talking about other skincare conditions, plus if we're working with neuromodulators, we usually don't do them on the same day, but they could be combined and space time depending what it is, because when you do neuromodulators, you're injecting on the muscle, inside in the muscles, and when you're doing PRP and some kind of procedures for improving skin texture, it's more superficial. So there's no contraindication to doing all these procedures in the same area of the body. It needs to be spread out period of time, giving the healing time and everything else. But that's when we get the best results, when we combine treatment and assess the whole skin texture, muscle movement, and everything else. And we have right now, we're going to show you a video. This is a video, just a sample to show you how mid-facing lifting is being done with different type of threads. And I will be commenting, and Sergey, add if you want, you could jump in and add if I missed something. But first thing to do, obviously, we'll assess the patient, and we do, let me decrease the sound a little bit. And we mark, after we did the assessment, did the pictures, we mark the patient's face, anesthetize, and anesthesia is done, could be topical, and then we do lidocaine anesthesia as well for the insertion point. There's a technique when we do anesthesia with the cannula in each trajectory, or it could be local, so different technique. And then once we start inserting, this is a barb thread that's being inserted with the cannula, and you advance the cannula in the right vector format in different placements. And once the thread is being placed in the deeper tissue, you have the pool. Usually it's a few threads that's placed together. And then we might combine different type of threads. In this case, we started with iris threads, and now we're adding smooth straps for the eyes. That's another procedure that could be done. So you might do a combination of different type of threads in different layers of the skin to get the right placement and the right results. And that's the results that you could see. As you could see, it's the cheek itself is lifted, the nasolabial fold is decreased. So kind of immediate results after the procedure, and eventually results will get better and better. So that's not the final result, and definitely something that we look forward to when we do these procedures, to see the final results on skin texture, like we did for under the eyes for this patient, and lifting for more deeper tissue to give that structure that we were discussing before. Sergey, you want to add something? Did I miss anything?
No, I think you were pretty accurate on everything. We should look at another very interesting procedure. I believe that everybody is going to be very interested in.
Okay, another procedure, which is exciting procedure, which is fairly new, at least in the United States, is buttock augmentation or body contouring with threads as well. So getting more and more popular, and there's a lot of demand right now for these procedures. But let's see the results that we could get when we do body augmentation with threads, not just the face. And then here we're using dual needles.
Well, it's a combination of dual needles plus the cannulated needles plus the spiral very long needles 2690 to fix the result. There are three different layers of lifting. We do a basic lift with a double needle procedure, which is market is done for this procedure at the moment. Then once we've done the major reposition of the tissue with the dual needle, we fix that result with the cannulated threads. And once we have installed the cannulated threads, we are fixing that result, the result that we have achieved with the spiral threads at the highest level of our instruments installed. So we actually have a pie, the dual needle, then the cannulated needle, and then the spiral needles on top of it. This patient still has the effect, and it's been 2 years.
Yes, once the threads are placed, that's another important part because a lot of complications come if this procedure, the step is not done correctly. We need to cut off the hanging thread, and we need to make sure that it stays buried in the skin tissue itself, because if that little piece of thread is hanging out, risk for infections and a risk for a thread being pulled out, and there's a lot of complications. So it's a very important step to make sure that it stays in place and it's not visible from outside until that skin opening heals. This is PDO threads and cannula that's being used. So we could use combined treatment in the same area. And for this patient, that's what we did.
And that's the third part with the spiral threads.
Yes, these are smooth threads, spiral threads for more superficial placement. And they are more for collagen stimulation and skin texture. If the spiral threads before were for more lifting, this is more superficial placement. And these are the beautiful results that you could see with these procedures. Since we worked with three different actually type of threads, we achieved the lift, we achieved the texture improvement, and kind of gave volume and support to the patient by using three different type of threads that we had in our arsenal, kind of pretty good results.
And quality of skin as well. And quality of skin as well.
Yes, it's a skin texture improvement. This is some of our students that get trained. And we actually have today some of our students joining us, and wanted to give them a chance to speak and kind of share their experience and see what are they doing with the knowledge that they gain. They're seeing good results, and kind of give us a little bit of background info on what are their thoughts on these procedures. Ayla, if you could.
Hello. Can you see? Yes.
Yes.
There you go. Hi, everybody.
Hi.
My name is. I have ITS Academy for the last 6 took multiple classes, and my most recent one was the PDO threads with Victoria Threads. It was an amazing class. I've actually incorporated so much into my practice, and my number one seller is actually PDO threads, the lips. What I use the PDO threads for is to crisp up the vermilion border after I have placed filler, and it has given me amazing results. It helps prevent migration. It gives me really a good structure, a good height. So my patients are loving it, and yeah, it's been a great experience.
Do you see good results with the treatments that you've been doing so far?
Yes, definitely. I also like to, after I do some Botox, there are sometimes there's some stubborn wrinkles that don't go away. So I cross hatch PDO threads, and it stimulates the collagen in the glabellar region, and my patients love that as well. And I also use Victoria's Threads multi-fill threads in the labial folds, which has given me good results, and it helps my patients stay away from filler, which I don't really like to put in the nasolabials because it gives a pug face. But with the threads, it gives a nice natural collagen stimulating effect. So I have been getting very good results with threads.
Okay,
Thank
no,
you.
great. Yeah, you were
Very
excited
happy.
about taking a class, I remember.
Yeah.
You had all your
That
models line up and you kind of had, no, it was pretty
I'm
good
glad we
results.
coached you for all this time.
I know, right?
Yeah.
She's number
You
one
were
student in my academy, taking all our classes, almost every single class. But that's good. No, I'm happy that you're doing well in your practice. I know you were very excited when you started, and I'm glad to see. Well, thank you for joining us, and thank you for, and good luck to. I will see you again this weekend for our body augmentation class. So I will.
you'll see me on Friday and probably the week after.
Okay. Thank you. Thank you.
Thank you.
Okay, this is some of the before and afters that we want to share, some of the models that attended our classes and some of the patients that our colleagues shared with us. As you see the results, lifting of nasolabial folds and getting volume and kind of getting a good support for the face. That was actually one of our students that we were able to contour the face, remove nasolabial folds, add the cheek volume. She didn't have any fillers done. This was just done with the threads. She's still a little bit swollen in the second picture, but pretty good results considering her skin texture and everything else. So she was very excited when she saw the before and after. So she was kind of interesting reaction that we got. That was another model that we had on our training. She had done the mid-third facelift, the neck, and we did under chin, I think, for her, right, Sergey, if I remember
Yes.
correctly?
Yes.
Yes, and a little bit bruised up right after the procedure, but when you look at the final result, pretty good result. The contour of the shape change and kind of tightened and lifted, so pretty good results overall. She was very happy with the results too. And this is our young gentleman, our speaker, who usually does try everything himself, no matter what he offers, but we've seen good results. Tell us your experience as a patient. What did you feel? What was the timeline, downtime, and kind of give us a little bit more information on the results. And this is the before and after results that we could see. And if there is a difference when we're working on the male face versus female face because of the structure and everything else. So can you please share your experience?
Yes, but just one second. I actually have another guest. She's not a student, but she agreed to participate in our webinar, and I wanted to introduce Emily Friedman. She's a physician's assistant from Chicago, and she worked with my face quite a lot. And I wanted to ask her to share her experience using our product and our threads. I know, Emily, you've been in business for so many years, so you know how you can compare different instruments. What can you give
She's the one who's keeping you handsome, Sergey? Is that what
Yeah.
that's the secret?
Yes.
Okay.
Thank
Okay.
you.
Thank you,
It's nice
Dr.
to meet you. My name is Emily Friedman. Yes, I've been a physician assistant for about 15 years. My background is emergency medicine, trauma surgery, and organ transplant, as well as aesthetics. So what I've done is I've married the two together in my career. And like Sergey was saying, he's been one of my lovely, clients, patients, friends, and he's been great to work on. And I love the Victoria threads. I love biostimulators. I love collagen stimulation. I love the lifting threads, the smoothing threads. I can completely agree with what the other gal mentioned in terms of the vermilion border. It just gives such a nice, soft, crisp look to the lips. But what we did on Sergey was we did some mid-face lifting threads. And he did just so great. I mean, just such a great candidate, softening those nasolabial folds. And what I find with threads is that you just get such a natural look, the from start to finish. Honestly, people walk out and they see a lifting effect immediately, even though we don't anticipate an immediate effect, but we see one anyway because we're moving tissue, we're migrating tissue back to where it needed to be. We see a lot of temporal wasting as we get older in our 40s. I love to focus on this mid face in the temporal area. With most of my clients, I would say that's typically where I start, and that's exactly what we did on Sergey.
Thank you. Thank you. You did a great job. What about how do you assess the actual quality of the polymer? I know you've worked with
Yeah, so the quality of the polymer is actually it's wonderful, to be honest with you. It's great. The the tensile strength of it is definitely comparable to everything else really that's on the market. To be quite honest, I've worked with Fiona, I've worked with Mint, I've worked with Nova, and I just get fabulous results, to be quite honest, in terms of lifting, collagen stimulation, thickening of the dermis, overall resurfacing. And so honestly, it's such a great quality product. All of them, the smoothing, lifting threads, the multi-fill, really all of them.
Thank you. Thank you. Okay. Thank you very much, Emily. I know that you have to run.
Yes,
Thank you very much for making yourself available for this short period of time.
yes, I love it. And if anyone needs questions answered or wants to reach out, feel free to anytime. Sergey, you're the best.
Okay. Thank you.
Thank you. Thank you, Doctor.
Okay.
Bye.
Bye.
Okay, Sergey, now tell us as a patient what was your journey? What did you experience? What did you feel? What was the recovery like? Is it as scary as people say and a lot of downtime, or was it more or less something that you could live with and still function? Give us the insights.
Yeah, yeah. Well, as you can see on this photograph, the one that's on the where it says Nithya in the background, that is that is exactly 1 year ago. And as many as any patient would have, I also have a thing that I work on all the time, and that is a nasolabial fold, which you can see very pronounced there. It's very, very deep, and there are many things that I was doing to correct that nasolabial folds. So we've done some collagen stimulation. We also have done some lifting threads. We've done collagen stimulation again after the lifting threads. We've done the volumizing threads. And in fact, I don't know if you can see through the screen, probably not very well, but that nasolabial fold has practically gone. And I don't think it is coming back in the next 12 months. Of course, I will be using more product to correct that defect going forward. But definitely the lifting threads enabled us to have some effect, and then volumizing threads that we've done over during the workshop that we conducted at ITS Academy. So, and effectively, you see the result on the left with the stubborn nasolabial. I call it the stubborn nasolabial fold, and what you can see me right now on the other side, that fold practically has gone. I also have asymmetry, and that's one of the reasons why this fold is so pronounced. And even with that asymmetry, which is very difficult to correct on patients' faces, we still were able to achieve, I think, amazing results.
What was the recovery like when you had it done?
Well, usually the recovery after the threads is 2 weeks. This is when you have to maintain minimal mimic activity. This is when I don't go to the gym. This is when I sleep on my back. But this is for a couple of weeks. Now, for patients that have not done, I have to make a few comments. I've been doing this procedure um, for the past 12 years. So I do procedure every year. However, if a patient comes and the patient has a bad ptosis condition, then we would have some very visible signs that the patient has completed some procedure. Obviously, I don't have these signs anymore because I do it every year. So my downtime may not be as typical as some other as a downtime for other patients. If
So,
you
so the more lifting that needs to be done, the more downtime would be because you have to do the hypercorrection, and especially the first time.
the
And as
easier
this procedure is done continuously, the downtime gets less and less because there's less tissue to lift, less
Yes.
tissue to pull.
The more you do, the less of the downtime you have.
Yeah, because I remember when you did it last time, I saw you less than a week and everything was gone. I don't remember seeing you being bruised up. Yeah, no, that's for sure. And the goal is not to do it once. Like, it's not a plastic surgery when you do it once and then you forget about it for 15 years. This is maintaining and working on tissue's natural ability to build collagen, which is another thing that needs to be explained when you do consultation. So patient has the right expectation. It's not like you've done it and there's nothing else that they should do. That's the maintenance that needs to be done every year, every 18 months. And what I've seen from experience, if you do a very aggressive procedure the first time because there's a lot of tissue to pull, if they come back a year later, you don't have to put as many threads. You don't do it as aggressively because whatever was done a year ago is still there. You're doing a couple of threads to lift and support the previous result. Am I correct? I think that's what I've seen, at least in my practice.
Yes.
Yeah, that's the common trend in the procedure. And this is our lovely patient that we seen before. She also had PRP done. As I said, was a combined treatment, not only threads, but work on some skin texture as well to get her the best results. And she did have great results. She's the type that have heavy skin, and putting threads on someone with her skin type, which is very similar to mine, you have to be careful to make sure you give enough support. And what also we do for someone that comes in, let's say, and have a lot of loose skin and there's barely any support inside, we might stage the treatment. We put mono threads first, couple of months before, let them work, build that collagen, build that base, and then do the lifting thread. So there is something to support the skin and the texture. So when we do the lifting, if there's nothing available under, doing just lifting threads and not giving support, that's not a good way of treating, because patient's not going to see good result. There's just not enough base available to do that for the patient. And I think we have another speaker, right? Sergey?
Yes, I wanted to bring on Tseki Wellington. She is our student, and I wanted to introduce her as one of the new users of Threads and see her experience and share it with us. Hey there, nice to see you.
Hi.
Hey.
How are you?
Just fine.
Oh, what I will say, I just took the class with you guys.
Last
Probably,
month, right? Was it last
yeah,
month?
just at the end of January. So I haven't gotten my hands wet yet. Which Sergey is helping me with that. So that I am grateful for as well, because I realize that a lot of patients that I have or clients that I see that ask a lot for PDO threads, because it does give good results. I've also done it myself a few times, so I could definitely attest to that. Also, coming to the school, I did learn a lot, and it was very, very, very hands-on. Like, we were there till very late. We
Until
also had,
7.
we had a lot of models. We got to see a variety of everything, even actual like complications, like not little things that could happen, that there's ways on how to treat
Right.
it, or you'll know when it's not the best time, to continue. So I did learn a lot. It was very, very informative and very, very hands-on. That's the most important. That was very, very good for
So
me.
you don't regret leaving at 8 o'clock that day?
No, and
No.
I think you guys had two models that also had canceled, weren't able. So we would have been there till midnight.
Yeah. Well,
We would
when you
be there
guys
till
ask for
midnight.
hands-on, we provide the hands-on
It
experience.
was a good amount of hands-on, and it was a very, very good experience.
Yeah.
Very good experience.
Excellent.
And I must say, even with now that I'm finished and everything, even with getting the threads from Sergey, he actually maps out everything, even with the patient's face, like client's face I've sent to him that I'm going to schedule to do. And he maps it out and goes over everything. So purchasing from him, a plus, people, a plus. A
Thank you.
plus.
Very well, very well. Well, thank you very much for the kind words, and we'll see each other in the next few days to go over those papers
Yeah.
that we haven't yet.
Yep.
Okay.
Thank you
Thank
so
you.
much.
Good luck. Good luck to
Learning
you.
from you.
I
Thank
will.
you.
Thank you, Taseki.
Okay, bye.
Okay, she's really excited. She was excited when we had her in class, so good for her. Good luck to you. We have some questions and questions that we have that would like to answer. Some of the attendees send us questions. Before I answer some questions, there's some information for those of you who have more questions to reach either us or if you want to speak to Sergey, there's information, there's phone numbers, QR code, and everything that if there's anything that we didn't answer, I think we gave enough information, but if something comes up, definitely. Our next training is scheduled on February 23rd, but that class is already booked. We usually try not to get more than 5 students. So the following class would be on March 30th. So whoever is interested definitely could let us know, call us, or we could register online. But let me answer some of the questions that came in. Sergey, that question to you probably, where Victoria threads are being produced. That's one of the questions.
Yes, these are about South Korean threads, and most of threads in the world come from South Korea. It's a center of expertise and center of knowledge for threads. So it comes from South Korea. They're FDA cleared threads, and they come from a factory called Dangwon. In South Korea, there are 5 factories that supply practically the entire industry with PDO threads. They manufacture very good polymer, which lasts for which shelf life is 2 years, and this shelf life is so long because there is a right combination of water and actual polymer and the right process of drying the threads during the manufacturing process, and that's how we get the traction. So yes, they come from South Korea, and one of the most famous factories, and they FDA cleared.
Yes, that was actually another question. If they have any FDA clearance, you just answer it. Yes, it is FDA clear. Another question that we have, and I probably will answer that question, who is allowed to perform this procedure? So PDO threads could be performed by RNs, NPs, PAs, MDs, all of the medical licensed professionals, and it's under your license. Obviously, you will have to have a malpractice that will cover you when you perform those procedures. You could reach out to your malpractice company and ask them to add this procedure as a coverage, but even with a registered nurse license, you're allowed to perform this procedure because that's the question. But it has to be as an RN. It's not an independent nursing intervention. You have to have a medical provider, either NP or MD, who would be prescribing these treatments to your patients. The patient has to have a good faith exam, documentation, assessment, and everything. And we talk a lot about it when we do training. We kind of discuss legalities of these procedures, who is allowed and not allowed. But yes, as an RN, you're allowed to do this procedure. And next question is complication. As with any procedures, if things are not done correctly, obviously there would be complications. So if whoever is doing the procedure is trained how to assess and offer this procedure to the right patient, if we assess the whole medical history, we do proper assessment, as I mentioned, good faith exam, and choose the right thread for the right skin type, for the right procedure or results that you're looking for, complications are very minimal. Yes, there's some bruising and swelling as with regular invasive procedures. That's not avoidable, but true complication happen usually when things are not done correctly. It could be infection because it's invasive. We usually use sterile techniques, sterile gloves, clean the face with betadine, with chlorhexidine. It has to be a sterile procedure because it goes into the tissue. It's invasive. Contouring or the thread, if it was not secured correctly, it could contour and be misplaced. Again, does not happen if things are done correctly, which we spend a lot of time during training showing that technique and making sure that people know what the correct placement is. If it's not placed in the right layer, that's another complication. So complications, as I said, with experienced provider, complications are very minimal. Seen some, I don't know if you looked into it, but there might be some articles coming up on the internet with nerve damage, with a lot of bleeding and hemorrhage and other complications. If threads are placed in the right layer, our nerves and bigger vessels are located on top of the muscle. Threads would be placed way above that layer. They should be placed subcutaneous tissue, some of the threads in the dermal layer. So if you're staying in the right plane, you shouldn't be even reaching the main nerve endings that we have in that area. You shouldn't be puncturing any big vessels because they're much, much, much deeper located anatomically. Things go wrong when things are not done correctly. I'm talking about more serious complications. Sergey, if you want to add something to this question, please.
No, I think you covered everything. And the most important thing is that the threads must be placed in a correct layer into the subcutaneous fat. If they are placed too superficial, they will contour and they will not resorb as fast. And if they are placed too low to the muscle layer, then they will not dissolve as fast. They will not resorb, and they will create some dimple-like effects. So if they're placed correctly, they should not be touching any nerve branches or vessels, and they should, in this case, even bleeding is not very common when it's done correctly. As in any procedure in medicine, you have to be very careful about what you do, and this is one of the examples.
Right. Another question is, can an LPN perform this procedure? Depending which state you are in. In New York State, no. Some other states, I'm trying to remember which one it was, where LPN could even do injectables and do threads too. So you need to reach out to your state board of nursing and find out which state you're in if you're allowed. In New York, as far as I know, and as I said, I teach undergrad nursing students, that's not part of their job description or within their scope of practice as LPN. Other states, I know they have more authority, so it might be if you're in one of the states that gives that permission, then yes. Some question in regards how much is the class, price list for the threads themselves, some other questions. In regards to the price list for the product itself, there's a phone number for Sergey that you could call and find out the details, because it depends on how much is purchased and what threads are purchased. It's a long list of products, long list of prices. So Sergey could definitely answer that question individually. And in regards to classes, we do have for the class, we offer class for beginners and advanced, and we offer classes. Price of the class depends on if you're just paying for the training or if you're purchasing the product. We have different price structure available for that as well. So again, once you reach out to us, you could definitely we could go over the prices that we have available. And for the training alone, the special that we have for upcoming classes is $1,500 per class per attendee. And if they're purchasing a product, Sergey, remind me the price for the class with the products.
Yeah, the price that would include a product and coaching is the $2,200. That price includes a material for 3 patients, and we will do coaching for the first 3 patients, mapping out the threads and explaining how to attend to each particular patient within your practice. This is something that we're actually going with Tashiki right now. So it's $2,200, and that includes some product for 3 patients for the first steps into the discipline.
Right. Another question I see here is what are our thoughts on other thread lifting companies that offer like we lift. I've seen also the commercial that they're saying less threads. Their threads are the strongest. I work with different threads. I've been trained on the PDO Max. I was trained in Nova threads. 2 things that I would like to make a comment on. Yes, you see different advertising for different threads, and I'm not going to say who's better, who's worse, or anything else. A lot of it also depends on the technique, how it's placed, and the texture of the patient's skin. What I've seen, if patient needs a lot of support and you're only placing 2 threads, there's barely any support. I shouldn't say it this way, but I don't care what the company says, it's just not going to give good results. That happened to me when I had my first thread lifting procedure, and I'm not going to say the name of the company that was used on me. I usually don't like to put anybody under the bus, but I had that situation because I was younger at the time. Whoever was doing the threads considered that I don't need that many threads, that much support. And I don't remember the exact amount, but I didn't have enough threads placed in me. Now that I know better, I realized at that point I wasn't placing threads or trained on it. I didn't see good results. I was very hesitant and disappointed at the whole procedure because I thought it's a scam. It doesn't work. And why would I offer it to my patient when I didn't see the results? So I'm not sure if doing less threads is the best option. Maybe for someone, yes, but if you do really want to see result and there's not enough support, you would like to give that support, but providing maybe when you're doing the procedure the first time, building that base and giving enough threads to give that support the following times when patient comes back, the second time, the third time, a year later, 18 months later, you already build the support structure. You could put less threads, and there's no need to put as many as when you did the first time. At least that's what my experience was me as a patient, and for my patients as well. I don't know, Sergey, if you want to add something to it. I've seen different results with different type of companies of the threads. Let's put it this way. It's not so much maybe the thread itself, even though it gives makes a big difference, but also the technique, the right patient, the right plan for treatment, and everything else. I don't know, Sergey, if you want to add something.
Well, I will be adding to this from the from the side of a manufacturer, because I want to have my product to be used, to be in good hands and to provide good results. So first of all is the quality of polymer, because we are repositioning the tissue and we are pulling the tissue, so we need strength in the polymer, so we need to create traction. Therefore, polymer that is in our hands, must have a very high tensile strength. In this case, we will be able to reposition tissue effectively. So that's number one. And number two, we need to use many threads on the patient, because our first and primary goal is to repositioning of the tissue and take the saggy tissue that we have on the patient and have it pulled back and have it fixed after 2 weeks of healing, and have that objective lifting received on the patient's face. So number one is the quality of polymer. Number two is the quantity of threads. There's no such thing as too many threads, let's say. Of course, you have to be mindful of the budget and what is enough, but you need to use many threads or enough threads on the patient, so a patient sees a result, and that result is pronounced and prolonged. We had a patient once, and I was very disappointed at what I was hearing. This lady came in for a consultation to be a model, and she told us that she went to one of the spas in New York City, and they've installed her 6 mono threads in the submental area, and they sent her home for 2 months for her to wait to build the collagen. Obviously, she did not get any result from the 6 smooth threads in the submental area, and that is a very, very bright example of how this should not be done. We can teach how you can do the right thing and do the right procedure for the patient, but number of threads is critical.
Yeah, no, definitely, for sure, because you want to give enough support.
Yeah.
6 mono threads, even on the eyes we put more. So I
6
don't know.
mono threads. Can you believe it? Yeah.
Well, I guess maybe someone wasn't
She was
trained properly.
crying.
Who knows? Yeah, who knows what happened? Yeah, I remember that patient. She was at the training. Yeah, so can we access Zoom? Yes, that Zoom is being recorded. Hopefully everything gets recorded correctly. We will send out the Zoom recording to all the attendees and all the registrants, so you will have that Zoom recording. And I think we answered all the questions. Again, if you have more questions, you have our contact information. Don't hesitate to reach out. And thank you very much for staying with us until the end. I hope you learned something new. I hope you learned something useful. And field of aesthetics is booming. It's exciting. So for those of you who already practice, please continue learning new things, because if you don't do it, it's all the way in social media. If you don't offer a new treatment, patient will find another practitioner who does, and sometimes you could lose a patient because those practitioners might be offering similar procedures to you, and if they leave your practice for one procedure, they might leave you completely. That's at least my motto. I always, something new and exciting comes up, I'm the first one to learn, because I want to see if that's something that I should offer my clients and they benefit, or if I see that it's not the right thing, then at least I could be educated and tell my patient, no, don't do it. It's not the right thing. It doesn't give results, or whatever the story is. So I'm trying to be usually on top of everything. And that's why we offer monthly webinars on new products, new treatments that coming available. So we need to be educated as providers and educate our patients as consumers as well, to detect the right procedure if it's for them, or detect the scams and whatever else might be out there on fields of social media and Google and everything else. Thank you very much again for staying with us. Sergey, if you want to add something.
No, I think we've covered everything. Obviously, we have the means to teach students how to use correctly the instruments. We welcome you to reach out to us to see the availability of the seats in the class for the 30th of March. There will be more classes. We do them every month at this time. And yeah, we will be waiting for your contact.
Yes, and happy Valentine's Day for everyone, whoever joined us. The holidays coming up. So thank you very much. And hopefully we will see you in our classes, or if not, follow us on social media. A lot of new information is coming up. Thank you, guys. Have a good evening.
Have a good evening. Bye-bye.